President Trump visited Michigan Thursday to tour a Ford Motor plant now producing ventilators. The president and Ford said he wore a mask while visiting the facility, but he did not wear one in front of the reporters who traveled with him. Company officials told the White House earlier this week that wearing a mask was a requirement. While there, the president met with African-American community leaders. He discussed new CDC guidelines about reopening churches. He said he considers churches essential services and that new guidance will be released soon.
We're going to open our churches again. I think CDC is going to put something out very soon. I spoke to them today. I think they're going to put something out very soon. We've got to open our churches. People want to go in. I saw a scene today where people are trying to break into a church. To go into the church, not to break in and steal something, to break in, they want to be in their church. I said, you better put it out, and they're doing it, and they're going to be issuing something today or tomorrow on churches. We've got to get our churches open.
Nancy Cordes and Alayna Treene join me now. Nancy is CBS News chief congressional correspondent, and Alayna is a White House reporter for Axios. Welcome to you both. Alayna, I want to start with you. We heard the president hint there at some new guidelines for reopening churches. Why is that a priority for his administration right now?
Well, as you may have noted, earlier this week, the White House has released the CDC guidelines that basically provided a roadmap for how the country should begin looking at reopening churches schools and businesses and restaurants, but they left out churches and places of worship, and that's something that the White House had heard a lot about. The president had a call with faith leaders this morning, according to officials that I've spoken with. And essentially, they urged the president, the White House, to include some of those guidelines on reopening churches and places of faith that were originally in an earlier version of those CDC guidelines, but weren't in the 60-page roadmap that they had released earlier this week. So that's part of that. They had some backlash. I would also say that the president has been getting a lot of input from faith leaders across the country, and of course, the evangelical community is a big community that helps put the president in office and is key to his reelection in the fall. So that's definitely something I think that is in mind as they push to move forward with these.
Well, Alayna, I also want to ask you about reports that the CDC is feeling muzzled by the White House. Why isn't the CDC taking a more public role in leading the national response to the virus?
It is something that a lot of people have remarked on, and I think it is noteworthy that normally in times of crisis, especially with regard to a public health crisis, the CDC are the ones who take charge in these situations. And we've seen CDC Director Robert Redfield at some of these White House coronavirus briefings, but largely it's been the coronavirus task force and leaders like Dr. Anthony Fauci and Dr. Birx that have taken on that role. So there is some tension here, and there was reporting in the past several weeks with regard to those CDC guidelines that there really was tension between those in the White House really spearheading this versus CDC leadership. They had originally hoped to release some of those guidelines that we just discussed much earlier this month, and they were held up because people within the White House and task force leadership had said basically that they thought those guidelines were too prescriptive and too restrictive on a lot of the states and communities that are looking to reopen. Of course, we've seen them revise that and put it out later this month, but it has really been a big kind of public relations issue for the White House, given the reporting on it. And I think that as we look ahead and for more of these reopening guidelines, I do think that we'll see some more input from the CDC, given the reporting around it. But it definitely is a noteworthy kind of tension between the two.
Well, Nancy, before he left the White House, President Trump said that he met with Senate Majority Leader Mitch McConnell. He said that they are working on a, quote, package of very positive things. What are the legislative priorities, Nancy, for Senate Republicans right now?
That's a great question, Elaine, because what we really see is sort of a split emerging among Republicans about what that package should include. You've got individuals like the Republican leader, Mitch McConnell, who has said point blank he doesn't want any more unemployment spending. He doesn't want to boost unemployment in this next bill by another $600 per individual. He has also downplayed the need to spend a lot of money for state and local government. governments. He says that he prefers a wait-and-see approach to watch how the initial tranche of money is distributed first. But then you've got other Republicans, most notably some Republicans who are up for re-election, like Susan Collins of Maine, Cory Gardner of Colorado, who say that a package is urgently needed. And in fact, Collins got behind a bill that would spend another $500 billion for state and local governments. You've got other Republicans calling for infrastructure spending, something that McConnell has really resisted. So there isn't unanimity at this point within the Republican conference about what should be in this next rescue package and how big it should be. And those conversations will continue now for, I suppose, the next week and a half, because the Senate is going to be on recess until early June.
Right. So, because Nancy, where do things actually stand in the Senate in terms of another round of stimulus legislation?
It's really at the conversation level, and that's it, Elaine. These divisions only became more apparent this week, and the Senate is now leaving town with a number of senators really wondering, is this something they'll tackle in June? Some hope that they'll get on it right away. Others are predicting that we won't see any kind of true negotiation between the Senate and the House, where they've already passed a $3 trillion rescue bill, that we won't really see these negotiations get underway in earnest until July and possibly August. So there's a lot of confusion right now about where things stand.
And you mentioned Senator Cory Gardner, so he's threatening to block the Senate's upcoming recess over relief legislation. But Nancy, how seriously is that threat actually being taken?
Well, apparently it wasn't taken very seriously at all, because the Senate ended up going on recess anyway. Gardner dropped that threat Thursday afternoon, saying essentially that he felt good about the progress that they were making. One of the big things that he was concerned about was giving businesses, small businesses that are getting loans under the PPP program, more flexibility for how long they have to spend that money. A lot of businesses have been saying that 8 weeks is too short a period of time. They want it extended. And so lawmakers have been going back and forth about what a package of fixes to this particular program should look like. The Senate got pretty close. They weren't able to pass something unanimously before they left town. The House is coming back next week to pass something similar, and then the Senate will likely take it up. So Gardner dropped that threat, saying he feels like they're headed in the right direction.
Yeah. Meantime, though, there are small business owners as well as individual Americans very much in a state of limbo at this point. Alayna, on another topic, I want to ask you about this new study from Columbia University, which says tens of thousands of deaths could have been avoided if the U.S. started social distancing earlier. How is the White House responding to that?
Well, Elaine, we saw the White House release a statement last night addressing those new estimates, and virtually they said that, touted how the president put in place travel restrictions on travel to China in January, and then later on Europe in mid-March. But I think it's worth noting that the country's domestic restrictions on and federal guidelines for shutting down a lot of businesses and shelter-in-place orders didn't really have any guidance from the White House until mid-March as well. And by that time, a lot of places, it was too late to avoid some of these massive numbers that we've seen in New York and other cities that were hard hit really early on to stop the spread of the virus. Now, a lot of public health officials, and I believe the Columbia University report itself noted that some of those guidelines did help in slowing the spread, and it could have been much worse if a lot of places didn't shelter in place that soon. But again, in a lot of places, it didn't happen early enough, and that's really, it's a tragedy to see so many deaths that could have been avoided if we had acted sooner.
Yeah, when you look at those numbers, it really is just so stark and sobering. Nancy, the House Coronavirus Select Committee held its first hearing Thursday. What more can you tell us about that?
Well, it really was pretty heartbreaking to listen to the stories of some of the witnesses that they asked to testify. These were all frontline workers, individuals who have had no choice but to go to work amidst this pandemic. They heard from doctors, a nurse, a bus driver, a custodian, and really difficult stories. One mother of a grocery store clerk who died of coronavirus, talking about how her daughter had to buy her own hand sanitizer, really wasn't given much in the way of protective equipment. A nurse talking about the fact that she has had to move away from her daughter because she doesn't want to get her infected, and the stress and the anxiety that causes. A bus driver talking about the fact that there's no such thing as social distancing on a bus, and that it's really a perfect petri dish for the virus. And so, you really. These are all facts that we know, but listening to these individuals from all around the country talk about their experiences was pretty heart-wrenching, and was really rekindling this debate about whether these frontline workers, A, have gotten the protective equipment that they needed, which in many cases the answer is clearly no, but also do they deserve hazard pay of some kind, and if so, should those payments be made by their employers? Should the federal government be chipping in? That's something that is in this House bill that just passed, this $3 trillion bill, but it is something that is going to be a fierce matter of debate in the months to come.
Yeah, but so important to actually hear those stories behind these numbers. Nancy Cordes and Alayna Treene, thank you both very much.
You're welcome.
Thank you.